Anorexia. Learn how to overcome anorexia 10 times faster. Written by Quinn Spencer. Narrated by Eric Boozer. What is anorexia? An in-depth overview of anorexia nervosa. An eating disorder as a result of which people become obsessive about the food they eat and their weight is known as anorexia nervosa. People suffering from anorexia nervosa become obsessive about maintaining a weight that is considerably abnormal for their age and height. People suffering from this eating disorder either exercise excessively or starve themselves to continue losing weight or prevent themselves from gaining weight. Anorexia nervosa is basically an unhealthy way of coping with emotional issues. People suffering from anorexia nervosa feel that they will be valued more if they are thinner. Overcoming anorexia nervosa is not an easy task. However, the unhealthy eating habits that people take up as a result of this disorder and the severe complications that are caused by this disorder can be reversed through proper treatment. Origins of the term anorexia nervosa. The term anorexia is of Greek origin, which simply means lack of desire to eat. Nervosa, on the other hand, contributes to the nervous psychological characteristics of the eating disorder. The actual meaning of the word does not, however, perfectly resemble the disorder. People suffering from it do not necessarily have a loss of appetite. They are rather scared of gaining weight. Anorexia nervosa is often shortened to anorexia. Technically, this is incorrect, as anorexia itself means lack of desire to eat, and has a different meaning altogether. However, in this book, the term anorexia will be used to define anorexia nervosa as a whole. What are the signs and symptoms of anorexia nervosa? As mentioned, people suffering from this eating disorder severely restrict the amount of food they eat, which results in weight loss. Often, they also exercise excessively to lose weight. Like bulimia, people with anorexia can also binge and purge. People with anorexia will also try to vomit after they eat to control caloric intake. Or they might misuse diuretics, enemas, or laxatives. There are numerous behavioral, emotional, and physical anorexia signs and symptoms that can help diagnose this eating disorder. Physical symptoms. People suffering from anorexia experience the following physical symptoms: abnormal blood counts, constipation, dehydration, dry skin, excessive weight loss, fatigue, insomnia, low blood pressure, osteoporosis, swelling of arms or legs. Behavioral and emotional symptoms. People suffering from anorexia showcase the following behavioral and emotional symptoms: depression, denial of hunger, excessive exercising, fear of gaining weight, irritability, social withdrawal. People suffering from anorexia usually do their best to disguise their eating habits, physical problems, or thinness. This is the reason noticing the signs and symptoms of anorexia is not an easy task. Thus, there are certain red flags to watch out for that can also help determine if someone is suffering from anorexia. People suffering from anorexia adopt rigid eating or meal rituals, avoid eating in public, complain about being fat even though they are not, cook savory meals for others but refuse to eat only particular foods that are low in calories and fat, skip meals frequently, check their weight repeatedly. The characteristics: anorexia nervosa. Anorexia nervosa is a life-threatening serious eating disorder in where an individual goes to extremes in order to lose weight, including self-starvation and excessive exercise. Eating disorders have no boundaries and affect people of all races, ages, economic status, and genders. It is estimated that 7 to 10 million women and 1 million men have an eating disorder. Anorexia is a very dangerous disorder which can be fatal when left untreated, as the lack of caloric intake affects all parts of the body, which include the major organs. The basic symptoms of anorexia nervosa. Typically, individuals are diagnosed with anorexia when their body weight falls below 15% of their normal weight due to their refusal to eat and maintain an above normal or normal body weight. These individuals typically have a history of self-starvation in which they will refuse to eat, and even when they do eat, they will self-induce vomiting. Many will also use laxatives in an excessive manner as well as diuretics. They perceive themselves to be overweight even when they are extremely underweight, and with their obsession to lose weight, many will often exercise to excess. Anorexia primarily affects women. It is estimated that 95% of individuals affected by anorexia nervosa are women. Typically, this disorder begins in early adolescence, and estimates are that 1 in every 100 young girls will experience this disorder. While the percentages are smaller, anorexia is also seen in men, young children, and adults. Anorexia is typically acquired by individuals who are high achievers and excel in work, school, sports, and other activities. Many people become anorexic to have the feeling of control over some part of their life, and in some cases, it is an act of rebellion towards their loved ones. Certain occupations also carry a higher risk for developing anorexia, which includes dancers, models, gymnasts, and runners. When caught in the early stages, anorexia nervosa is a very treatable disease. However, most individuals with this disorder refuse to admit that they have a problem and will not follow any form of treatment plan. Anorexia causes: cultural pressure, psychological issues, biological causes. What are the anorexia causes? That's the first question that would come to anyone's mind after learning about what is anorexia. Many would blame the current trend of connecting slim with beauty and attractiveness. Even though our culture's idolization of thinness plays a major role in the development of anorexia, there is actually more to anorexia causes than just the trend. Eating disorders have been around for centuries. It is only recently that people have become aware of the dangers of this issue and caused it to gain limelight. Most of the time, several factors contribute in developing anorexia nervosa, not one or two. One must also realize that dieting and anorexia has differences. Dieting is an attempt to lose weight through lesser eating, whereas anorexia includes excessive dieting. To make things easier to catch, we have divided the causes of anorexia in several factors: cultural pressure, psychological issues, biological causes, family pressures, life transitions. Cultural pressure. As mentioned above, our culture's trend to idolizing thinness plays a major role in anorexia causes. To many, being thin represents success, happiness, and control. Women are easily convinced that dieting is a necessity when it comes to being slim. The media plays a major role in it. The problem arises when models portrayed in the media are themselves underweight. This often causes women to standardize a body structure which is underweight and dangerous. In addition, in certain occupations such as dancing, modeling, and various sports, the pressure to maintain a specific weight and body structure is enormous. Psychological issues. People suffering from anorexia usually have ties connected to not only weight loss, but also factors such as physical fitness, self-imagine, or even career. Psychological issues that can make a person more likely to develop anorexia are low self-esteem, feelings of ineffectiveness, poor body image, perfectionism, depression, physical or sexual abuse, need to feel special, unique, lack of control of oneself. Biological causes. Various researchers suggest that anorexia may run in families. People with high levels of cortisol, a brain hormone most related to stress, and/or epinephrine, and decreased levels of serotonin, which is associated with feelings of well-being, tend to contribute to the anorexia causes. A girl having another member of the family or a relative suffering from anorexia is 10 to 20 times more likely to develop anorexia than a general person. Brain chemistry also plays a role in the issue. However, experts do not know how serious the inherited factor may be. Family pressure. Along with the cultural pressure, family pressures or styles might contribute to developing anorexia. In family-related cases, anorexia develops as a struggle for independence or individuality. Most of the time, anorexia is found during the period of adolescence when new demands for independence occurs. Girls suffering from anorexia might have a family background such as rigid, overprotective, overvaluing appearance and thinness, being physically or sexually abusive, criticizing a child's weight or shape. Life transitions. Life transitions can often contribute to developing anorexia, especially to a person already vulnerable to the factors described above. Such factors are named below: beginning adolescence, breakup of relationship, death of a loved one, failing in schoolwork, sudden exposure to dieting. Anorexia complications. Anorexia complications vary in degree and in severity. Anorexia, in its most fatal complication, can lead to death. This can come as a surprise to many because anorexia can lead to death even if the sufferer is not the least underweight. Anorexia complications can lead to other illnesses as well. Anorexia does not only lead to so much physical suffering on the part of the individual, but his or her mental health may also suffer as well, not to mention the great deal of stress and pressure this can bring to the anorexic. If someone has been suffering anorexia for a long time, it can lead to severe anorexia complications and health problems that can leave a permanent scar to the individual's overall well-being, such as damaged bones. Individuals with anorexia are prone to great risk of poor circulation and cardiovascular problems, poor heart conditions, such as coronary heart disease and irregular heartbeat, or otherwise known as arrhythmia. There are instances that anorexia can lead to another eating disorder known as bulimia. This involves an individual binge eating, then immediately forces themselves to vomit, either through self-induced gagging or by way of diuretics and laxatives. Other anorexia complications are imbalance of minerals in the blood, such as potassium, calcium, and sodium. These minerals play an important role in keeping our body healthy. One common anorexia complication under this is low levels of potassium, or also known as hypokalemia. This can cause weakness, tiredness, dehydration, and kidney damage. Low levels of calcium can cause muscles to contract painfully. This is also known as spasms. The lack of calcium and vitamin D can cause damage to our bones, and the lack of sodium can cause individuals to become confused. Anorexia complications can include low blood pressure or hypotension, low blood sugar or hypoglycemia, anemia, dental problems such as tooth decay due to the constant vomiting, since the stomach acids have an unwanted effect on tooth enamel. There is also renal failure, liver damage, heart failure, osteoporosis, and loss of muscle strength, which is more common in females, loss of sex drive or libido, and impotency in men. These anorexia complications are too numerous to be taken for granted. If someone you know is showing signs of these, coupled with their obsession in remaining thin, then you may be faced with an anorexic individual who may need your help and support. Anorexia cure, effective and permanent natural treatment. Anorexia is a serious mental illness associated with reluctance to eat. It requires effective treatment to cure it as early as possible, as this mental disorder has highest mortality rate than any other. Person of any age, race, gender, and class can suffer from this, though, and it's slightly more common in women. The person suffering from anorexia has a very strong fear in his mind of gaining weight, which makes him extremely reluctant to eat. Person suffering with this gets dangerously underweight and can develop other complications to his health. Some symptoms of anorexia are sudden loss of weight and growth of thin and soft hair on the face. The person with anorexia can cook food for others, but will be reluctant to eat himself. Sometimes person cannot eat in front of others and cuts the food in very small pieces before eating it. Person suffering from this disorder consumes lots of medicines to remain thin and to cut the extra calories, which he has not consumed at all. Too much use of laxatives, diet pills, taking vitamin and other supportive pills as an alternative to eating, and even engaging in self-induced vomiting are a few other symptoms of anorexia. Apples are a rich source of vitamins and minerals, and along with milk form sufficient diet for an adult person. Eating apples and later consuming a glass of milk with honey mixed in it will not only provide sufficient energy and vital nutrients to the body, but it also casts positive all-around effects on the health. Such a diet helps in gaining mental clarity to come out of obsession. Almonds and walnuts are also very helpful in curing anorexia effectively. Almonds can be soaked overnight in the water, and in the morning a paste can be formed by grinding them after removing their coating. The finer the paste, the more effective almonds become in curing anorexia. Almonds have properties to sharpen the memory and activate brain cells. Increased intake of all kinds of fruits are helpful in getting permanent treatment for curing anorexia. Fruits are light on digestive systems, low in harmful calories, but rich source of necessary nutrients. They can promote the normal functioning of all the systems of the body to counter anorexia too. Chewing basil leaves on a regular basis twice in a day is also a very good treatment for anorexia, as basil has medicinal properties, which are particularly very useful in flushing out toxins out of the body accumulated in stomach or flowing in blood, which eventually augurs well for mental health too. Garlic also provides effective treatment for anorexia, as it purifies blood and is very good appetizer. It can be used in food, soup, and as a salad ingredient in raw form too. Amongst herbs, horseradish has been used since ages for treating anorexia due to its appetite-enhancing properties. Healthy habits are also very crucial for effective and permanent treatment of anorexia, like exercising, involving in recreational activities to counter stress and depression, sleeping for sufficient duration, water consumption, and avoiding processed food. Avoiding intake of tea, coffee, alcohol, and beverages is very important, as these cast adverse effects on the treatment. Anorexia facts. Anorexia nervosa, commonly shortened to just anorexia, is a mental condition that affects mostly women and is basically a phobia or intense fear of gaining weight. This being a case, I will refer to the subjects in the feminine form. The anorexic sufferer is obsessed with food control, and although in most cases is painfully thin, she feels she is overweight and applies severe limits to her intake of food. This preoccupation with food consumption is a major issue in the life of the anorexic, and is usually accompanied by extreme anger and anxiety. The passion over food regulation is thought to be a desperate effort to ease the tensions of stress. These are the observations that usually denote an anorexic person. A persistent resistance to being a normal body weight for her height. Possesses an extreme fear of putting on weight. Has the illusion that she is very fat, although the opposite may be true. She will miss 2 or more periods if past puberty. She is convinced that normal body weight is too fat. Can men become anorexic? Males can become anorexic, but statistics show that the condition affects mostly women, and reveal that 80 to 95% of anorexics are female. In the past, there were suggestions that women of African descent were immune to anorexia, which seems to substantiate the very rare cases among Negro races. No hard facts seem to be abundant regarding eating disorder, not only among African races, but also among Latin and Asian races, and the descendants. Maybe the pressure of Western social life or a contribution to phobias in general. Who knows for sure? What is the cause of anorexia? Anorexia doesn't have any one known cause apart from being an eating disorder that is a known phobia of compulsion. The good news for any anorexic is that it is now a recognized illness, and it is treatable. But although the condition is complex, several likely causes have been suggested by the psychology experts. Western culture, where women are under pressure to stay young and sexy, and role models are constantly exposed by all forms of media, this can prompt a feeling of failure in less secure-minded people. Within the family, a sibling or mother or anyone else in the household who has anorexia can pass it along to anyone vulnerable to accept it. Parents who overdo their obsession with looking good will affect a child. Perhaps a schoolgirl a little overweight. Nobody is too young to get anorexia. A traumatic event like rape or even starting a new career or job can lead to anorexia. Self-disapproval. Someone who doesn't like herself and dislikes her looks or feels left out or abandoned. Often, it can be fear of failure to reach goals and perfection. Finally, basic physio, genes, brain transmitters, and biological chemicals may cause anorexia. Those uncontrollable factors in our makeup that make us catch cold or suddenly develop a headache. Personality change. This batch of anorexic facts reveals a sad story. Anorexics never act like themselves and tend to change personalities. They may seem obsessed with talking about meals and food, or have mood swings, not wanting to socialize. These are problems where a good psychiatrist will be the best form of medicine, and the anorexic's friends need to be patient, as someone they know is trapped inside a destructive phobia, unable to get out without help. Anorexia Nervosa recovery and the bar cycle. Anorexia nervosa is a serious condition that can lead to starvation and death. There are different beliefs as to the nature of the condition, being physical, mental, or even an addiction, because it has characteristics of all. While professional diagnosis and treatment are essential in genuine anorexia cases, much can be accomplished on the self-help basis to ease the symptoms and aid in recovery. This will discuss the nature of the condition, traditional treatment, and self-help using the bar cycle. Anorexia, the disease, the addiction. This condition usually involves a low self-esteem described as body image. An anorexic has a body image of being fat, even if they are thin and starving. Anorexics will severely reduce eating or severely increase exercise to try to correct this false body image. Since the body image is imaginary, they are never able to reach an acceptable weight and often starve themselves to death. Anorexia can be caused by some conditions, such as nutritional deficiencies and medical drug side effects, leading some to consider this condition a physical disease. Most people would consider it a mental disorder because of the strong beliefs and resistance to treatment involved. Whether caused physically or mentally, anorexia nervosa has all the characteristic traits of an addiction, making it possible to accompany traditional therapy with powerful self-help techniques to permanently change how patients see themselves. Traditional anorexia treatment. This condition is usually diagnosed once someone is significantly underweight and still believes they need to lose weight. Professional interview and treatment are necessary because a symptom of anorexia is the irrational belief you are overweight. This treatment can involve antidepressants and other medications, psychological counseling, and often hospitalization or residential treatment for the severe cases. The bar cycle and anorexia self-help. The bar cycle of human motivation describes a process you can use to control compulsive behavior. Instead of repeating that description here, we are going to jump right into how the cycle can be used to help control anorexia nervosa on a self-help basis. The key is the belief part of the cycle. Since a false body image is at the root of anorexia, we need to change our belief about our bodies and how important our weight is to our lives. Like any addiction, a poor self-image is at the root of the behavior, so our approach towards changing our belief has to be both general, self-image, and specific, body image and weight. With self-image, all the steps described in the bar cycle apply, including self-talk, positive attitude, elimination of negative attitudes, positive behaviors, etc. All of these improve how we see ourselves, so over time, we will not feel compelled to engage in compulsive behaviors to try to fix ourselves. With body image, you apply the bar cycle to specifically program how you see your body. To counteract the false belief about being fat, we can get objective data, like the body mass index, that specifically describes our healthy weight based on height. You can weigh yourself and use an online BMI calculator to regularly monitor your weight. This should be done at least daily so you have the true data to use every time you're tempted to think of yourself as fat. Add to this an appointment every few months with the doctor to confirm your data from an objective source. Also, the affirmations you use to change how you think should specifically address your body. Use statements like, "I am the perfect healthy weight for my size and age. I always enjoy eating the right amounts of good foods to maintain my health and energy. When I look at my body, I see an attractive, healthy, energetic person. I know I'm far more attractive because I'm healthier, no matter what I weigh." These statements should be repeated frequently every day, so they stay fresh in your mind, and you can recall them to push out and replace the negative body image ideas when they come. For most who suffer from anorexia nervosa, professional treatment is a requirement. Denial is a major symptom of this disease. That said, the self-help steps covered in the BAR cycle can increase the effectiveness of treatment, reduce recovery time, and permanently change how we see ourselves. You can move from self-loathing to self-loving in a matter of months. Anorexia, not a physical but an emotional disorder. Anorexia nervosa, or anorexia as it is normally referred to, is an eating disorder that many people suffer from. Anorexia is a condition that goes far beyond dieting to lose weight. A person who suffers from anorexia will often start out trying to lose weight through dieting, but with time the weight loss becomes something the person has overdone, and it begins to take over their lives. Many more women than men end up with anorexia, so for future references in this book, we will use females as our example. The desire to become skinny begins to play a key role to the person who suffers from anorexia. She often falls into a deep cycle of eating, excessive exercising, and using way too many diet pills and laxatives. She may get to the point where she looks like a walking skeleton due to the fact that she has nearly starved herself to death. She may also begin to give herself enemas and will hide the fact that she is hardly eating from close friends and family. In fact, the anorexic person may go as far as to make it appear as though she is eating more food than the average person, only to vomit it up later on purpose when no one is around. She may also become very defensive when someone brings up the fact that she is too skinny, and she will often say that she was born this way and is unable to gain weight. Most usually, anorexia begins in adolescence, but it can also occur in children and full-grown adults. It is estimated that 1 of every 100 people in the U.S. are anorexic, and they are almost always girls. In fact, 95% of all anorexic people are female. Whites are much more apt to become anorexic than any other ethnic group, and it is much more prevalent in middle and upper-class families. It is thought that genetics plays a role in anorexia, although there is no certain cause of it. There may be one specific gene that is responsible for a person being anorexic, but more testing must be done to be sure. Some people believe that a dysfunction in the brain is the cause of this condition, but until more studies are done, we simply cannot say for sure. Maybe feeding troubles as a baby or a general history of not eating enough triggers anorexia, or maybe it can be brought on by feelings of inadequacy. Treatment for anorexia is often sudden and drastic. The sufferer is often forced, against their will, into an inpatient treatment center that is designed for anorexic sufferers. Intense therapy takes place, and if necessary, forced feeding are done in order to save the person's life. Although there are some good results by this cliniques, anorexia is often a lifetime disorder. The sufferer has to be extremely careful not to fall back in their old habits. Common myths and misconceptions about anorexia. People have many misconceptions about anorexia. Due to poor understanding of the phenomenon or due to various popular myths surrounding eating disorders, most people assimilate denatured ideas regarding anorexia and the persons it affects. Probably the most common misconception describes anorexia as an incurable, terrifying disease. Although anorexia can cause both physical and psychological harm, this type of eating disorder can be successfully treated, and its undesirable effects can be overcome in time. In fact, through the means of an appropriate therapeutic program, the great majority of patients diagnosed with anorexia can be completely recovered from the disorder in a relatively short period of time. Statistics indicate that more than 80% of people that have been confronted with anorexia at a certain point of their lives have been completely recovered with the means of psychological counseling and the help and encouragement of their families. Furthermore, most of the people affected by anorexia in the past have been able to achieve emotional balance, regaining full control over their lives. However, the truth is that anorexia needs to be timely discovered and prompt intervention is required when dealing with this type of disorder, as the affected persons can inflict themselves a lot of physical and emotional damage. Another popular myth surrounding this type of eating disorder suggests the idea that anorexics do not eat. This idea is completely exaggerated and unfounded. Although anorexics are very restrictive with food, and they indeed keep drastic diets, they are human beings after all, and therefore they need to eat. In order to achieve their goal of having a slim body, anorexics usually avoid foods that are rich in calories, and therefore they commonly follow vegetarian diets. Every once in a while, anorexics may also engage in binge-purge behaviors, eating exaggerated amounts of food at once, only to dispose of it right after by vomiting or by using laxatives and diuretics. However, this behavior is more common among bulimics. People also commonly confuse anorexia with bulimia. Although anorexia may resemble bulimia and people generally experience difficulties in separating between them, each of these two common types of eating disorders has various distinctive features. However, people with eating disorders can have oscillatory behaviors, and anorexics can easily become bulimics or vice versa. First of all, from a physical point of view, the main difference between anorexics and bulimics is body weight. While most anorexics are underweight, bulimics often have an average or above average body weight. Therefore, unlike the case of anorexics, it is even more difficult to identify a person who suffers from bulimia. From a behavior point of view, the main difference between anorexics and bulimics involves their eating habits. While anorexics commonly keep drastic diets and restrict their intake of calories, bulimics predominantly engage in binge-purge acts. From a psychological perspective, the main difference between anorexics and bulimics is that people with anorexia have a stronger will and ambition than bulimics. While both these categories have a low self-esteem and a disordered self-image, bulimics are often more likely to suffer from depression. Their contradictory, ambivalent behavior that fluctuate between binging and purging food render them very vulnerable to developing feelings of guilt and confusion. Diagnosis of anorexia. Usually it is the general practitioner who diagnoses the problem based on the symptoms. The general practitioner, GP, usually suggests the person to go for some medical tests and examines to verify the diagnosis. These tests will help the GP to determine the cause of weight loss and to know the extent of damage done due to weight loss. It also helps the practitioner to rule out any other complications associated with anorexia nervosa. Sometimes, some tests need to be repeated to monitor the patient's health condition. The examination includes physical examinations. This includes examination of stomach, blood pressure, temperature, weight, examination of eye, mouth, and skin to rule out any other medical complications. Medical tests. These tests are needed to know the functioning of the vital organs of the body, including liver, kidney, thyroid gland, gallbladder, etc. The important tests which GP usually prescribes are blood test, blood count, ELISA, Western blot analysis for identifying specific antibodies and proteins, bone density test for osteoporosis, thyroid hormone test, SMA-20 test that include test of albumin, potassium, and chlorine level, glucose test for diabetes and hypoglycemia, secretin, CCK test to assess functional level of pancreas and gallbladder, liver function test, total protein test, ECG, electrolytes, kidney function test, urinalysis. Psychological examination. Anorexia nervosa not only brings physical problem, but the mental problems too. The psychological examination aims to evaluate the complications with behavior disorder and the possible treatment plan thereafter. The expert generally evaluates the mental disorder with history taking, observation, asking several questions about eating habits, or with the help of assessment questionnaires. How to help a child with teenage anorexia nervosa. Teenage anorexia nervosa can be a very frightening condition for the families that are dealing with it. Parents need to realize that children who begin experiencing with this form of weight loss will eventually suffer from the other medical conditions as well. Therefore, it is very important for parents to be aware of the signs and symptoms related to anorexia, as well as a few of the ways in which the parents can help the child deal with and overcome this condition. The first thing that many parents need to remember is that the children who are dealing with teenage anorexia generally do not realize that this is a problem. They are often dealing with teenage self-esteem issues, and they believe that what they are doing is going to benefit them. These children are often dealing with distortions related to body image and the way that they view themselves. These issues are very difficult to overcome and may be out of the parent's realm of understanding and capabilities. Therefore, when parents believe that their child is suffering from anorexia, he or she needs to contact a mental health professional immediately. This professional will be able to help the child identify distorted thoughts and help them work on their self-esteem. Next, parents or teenagers suffering from teenage anorexia can spend some time doing some background checking related to what their child has been viewing on the internet. Given the amount of information that is available on the internet today, many kids are spending time researching anorexia nervosa online in order to better understand how to plan meals, what they should or should not eat, and possibly even how to hide it from others. If parents find that their children have been looking at these sites, then he or she may also be able to use this knowledge as a way to address the topic with their child. Open communication will definitely be needed to determine if the child is suffering from this eating disorder. Parents will want to find a dietitian that can work with the child suffering from teenage anorexia. This individual will be able to help the child develop healthy and appropriate meal plans. It may be very important for the child to start eating more balanced meals at a slow pace. A dietitian will be able to help the child accomplish this while getting the vitamins and minerals that he or she needs in order to be healthy. This professional will also be able to help the child select foods that he or she enjoys eating and that the child believes are healthy for him or her. That is best for children with anorexia because they want to be able to have control over their food options. Finally, some parents may want to discuss the possibility of antidepressants for their child suffering from teenage anorexia with a doctor. Because this behavior may be triggered by anxiety and depression, psychiatric medications may help the child by stabilizing the child's mood and decreasing some of the anxiety that also coexists with it. While medications may help some children, parents should realize that it would not help all children. Medication may not decrease the possibility of relapse either. Therefore, all of these issues should be discussed with the doctor. How to overcome anorexia nervosa. You can overcome anorexia nervosa with a combination of interventions. You can complement medical care with anorexia self-help approaches. Overcoming eating disorders like anorexia and bulimia is a stressful health issue that can ease away with complementary strategies that will maximize your ability to succeed. This condition is a life-threatening condition that requires medical psychological interventions. You can overcome anorexia nervosa by adding anorexia self-help approaches like hypnosis into your treatment strategies. Medical problems. Many consider this condition to be a psychological problem, and it is. However, it is also a medical condition that can have serious ramifications on your overall health. You may require treatment for dehydration, malnutrition, and electrolyte imbalances, among many other complications and conditions. Psychological problems. You need to address the medical and psychological problems in order to overcome this eating disorder. There are complex thoughts that work on many different levels that feed into this condition. Behavioral interventions may be required to help rehabilitate you. The anorexia self-help plan that you choose should complement the medical and psychological interventions designed by your personal care physician or your psychiatrist. Psychological interventions. When you seek help to stop anorexia in its tracks, you are taking on a few different treatment approaches. Psychotherapy is excellent in helping you build self-esteem. It can help you develop proactive ways of dealing with negative emotions and distress. Cognitive therapy can also be used as a way to help you take control of your thought processes. Once you are able to think about food in a realistic way, you are better able to handle your condition. Behavioral interventions can help you rehabilitate yourself. You need to adopt healthy eating habits and follow through with a healthful lifestyle that will help you look and feel better. Psychotherapy works on your emotions and self-esteem. Cognitive therapy helps you think realistically and clearly. Behavioral interventions help you follow through with your actions. These elements work together beautifully, but they require more help for maximum success. Interesting features of anorexia. Anorexia is a very common neuropsychological disorder that has a very high incidence in the young population. Anorexia is not just an eating disorder, it also involves many addictive behaviors and the development of various phobias related to food and being fat. Anorexics develop inadequate perceptions of their physical appearance, and they often see themselves as fat, regardless of how much they actually weigh. Anorexia is a very complex disorder caused by multiple interrelated factors. Although in the past anorexia was thought to be a purely psychological disorder, recent studies have revealed that it occurs on the premises of neuropsychological dysfunctions. Certain environmental factors also play a major role in the development of anorexia, and the disorder seems to occur due to poor adaptation to the requirements and the ideals imposed by the society. In many cases, anorexia is developed by teenagers who come from very restrictive, demanding families. Children raised in a cold, insecure, non-functional familial environment are very exposed to developing anorexia. Young people who originate from dysfunctional families often suffer from depression, emotional insecurity, and low self-esteem. Features that can facilitate the development of anorexia are other types of eating disorders. Despite its pronounced environmental valences, anorexia is not entirely a psychologically induced disorder. Medical scientists also suspect certain genetic factors to contribute in the occurrence of anorexia. Various studies have revealed that most patients have a family history of the disorder, suggesting a pronounced hereditary character of anorexia. Scientists believe that the genetic dispositions to this type of disorder can be easily transmitted from one generation to another. Hence, people who have blood relatives with anorexia are also at risk of developing the disorder. Although anorexia can occur in both sexes, the disorder has the highest incidence in the female gender. Anorexia is very common in adolescents, but it can also affect very young children or adults. Despite the fact that the disorder can occur in virtually any ethnical group and culture, anorexia is a common problem in Western society. The high prevalence of anorexia among people who belong to well-developed social-economic groups confirms the pronounced influence of environmental factors in the development of the disorder. The excessively promoted topical ideas of beauty and the pressure exercised by modern society upon the young have a great contribution in the occurrence of the disorder in teenagers. The categories of people exposed to the highest risk of developing anorexia are teenagers, athletes, people with careers that require maintaining a slim body, models, actors, and dancers, people with a family history of the disorder, people who come from dysfunctional families, and people with emotional problems, low self-esteem. Overweight children and teenagers are also very exposed to developing anorexia. People who suffer from anorexia may in time also develop bulimia, a similar type of eating disorder. People who suffer from anorexia need a lot of help and support in order to overcome their condition. Although people with eating disorders need to show a lot of ambition and cooperation in the process, anorexia can be effectively overcome with the means of psychiatric therapy. Overcome anorexia nervosa with hypnosis. Self-hypnosis is a wonderful addition to overcome anorexia nervosa because it complements psychotherapy, cognitive therapy, and behavioral interventions. You no longer have to struggle with your core beliefs and self-image when you adopt hypnosis as anorexia self-help. Psychotherapy and hypnosis. Hypnosis helps you use your subconscious mind to accept the suggestions given in psychotherapy. You are better able to be receptive to building a new self-image and improving self-esteem when you begin with the subconscious mind. Each session leaves you relaxed, calm, and ready to change your feelings about yourself. Cognitive therapy and hypnosis. Cognitive therapy uses the conscious mind, and you can complement this by using your subconscious as well. It is difficult to change your way of thinking when your subconscious mind works against the new concepts and thought patterns. Hypnosis helps you change your way of thinking on a subconscious level, making you more receptive to change your thought patterns. Behavior in hypnosis. The goal is to change your pattern of behavior. Your habits are automatic. When you use self-hypnosis to change your behavior, you are addressing habits at their source. Your habits will change with less effort. Combining medical and psychological interventions in the treatment of eating disorders is ideal. You can maximize the benefits of each approach when you adopt hypnosis as a way to overcome anorexia nervosa. Predictors of treatment outcome for anorexia nervosa. Predictors of poor outcome for anorexia nervosa include longer duration of illness and the presence of vomiting. In more recent studies, researchers found that eating disorder duration did not predict outcome. They also found that the duration of the illness was not related to treatment outcome. However, others found that the outcome of treatment could be determined by the duration of the disorder and anorexia nervosa. Many of these studies conducted by well-known researchers are contradictory. It is not certain that researchers have found the methods with which to predict treatment outcome with any certainty. They are using the obvious etiological factors that there are many things still undiscovered about these disorders. The literature stated that age of onset carried prognostic significance. Several other studies found that early onset of illness is a predictor of positive outcome, while other studies have not found this to be true. Researchers found that anorexic patients who purged and had additional social disturbances had a significantly lower chance of recovering. They reported that anorexics who were also bulimic and who met full criteria for anorexia nervosa upon admission had a more severe outcome than those who did not meet full criteria. Certain laboratory tests have been shown to be excellent predictors of outcome in anorexia nervosa. Researchers found that restrictor-type anorexia and low serum creatine levels were predictors of earlier recovery. They reported that patients with high creatine levels did not respond well in treatment. Serum creatine levels revealed purging behavior in patients who tried to conceal the fact they were purging. Researchers reported that patients with psychiatric problems and severe core eating disorder psychopathology would do poorly with brief, low-intensity treatment. Others hypothesized that comorbidity would predict a poorer outcome in eating disorders. They also found that anorexic patients with personality disorders had significantly worse outcomes after 1 year follow-up than those patients without personality disorders. They found in their study that percent of ideal body weight type of eating disorders had the strongest predictive value in regards to outcome. The researchers reported that each 10% change in percent of body weight corresponded to an 18% increase in eating disorder severity. The lower a subject's weight, the less likely she was to recover within the follow-up period. Researchers found that fewer patients recovered from anorexia nervosa than from bulimia nervosa or a combination of anorexia nervosa and bulimia nervosa. The type of eating disorder was a significant predictor of outcome with anorexics because they're least likely to recover. At 1 year follow-up, in one particular study, only 10% of their subjects had obtained full recovery. Researchers found that patients with a history of anorexia were more likely to do well in treatment. Their findings do not support those reports that show that a previous history of anorexia is a non-significant predictor of outcome. Others found no differences in outcome in those who had a history of anorexia nervosa and those who had no history of the disorder. They reported that a diagnosis of anorexia nervosa at admission was not associated with outcome status. However, another researcher found that a history of anorexia was a pre-treatment indicator of poor prognosis. As you can see, outcome studies are extremely difficult to conduct. There are so few comparisons in the literature, with many of them contradicting each other. Self-destructive behaviors of girls with anorexia. The desire of having a beautiful, slim body determines girls and young women to take drastic actions. The society we live in puts a lot of pressure on the shoulders of young girls by establishing and supporting exaggerated physical features as ideals of beauty. Teenage girls struggle to get noticed and sustain assiduous efforts in their attempt of improving their physical appearance. Their constant preoccupation with body weight sometimes becomes an obsession, and many young girls develop eating disorders. Eating disorders are considered to be serious illnesses, and they may even lead to death. These disorders are basically mental conditions that are characterized by unhealthy behavior, scarce eating, and obsession with being overweight. Anorexia, anorexia nervosa, and bulimia, bulimia nervosa, are the most common and the most dangerous eating disorders. Anorexia affects persons of all ages and regardless of sex. However, young girls are more susceptible to developing anorexia due to their ambitions and desires of being thin. Girls with anorexia eat very little food, and sometimes they even constrain themselves from eating any food at all. Abstinence from food leads to serious complications, and girls with anorexia often develop other diseases due to their bad eating habits. The lack of vital nutrients triggers a lot of changes inside the bodies of anorexics, making them feel weak, tired, anxious, confused, and physically unstable. Girls with anorexia also experience a lot of physical changes. Their growth is dramatically slowed down. They suffer from stomach aches and internal disturbances, migraines, heart problems, bad circulation of the blood, hair loss, and dehydration. Inappropriate eating habits cause hormonal imbalances, and girls with anorexia often suffer from amenorrhea. This condition refers to irregular menstruation, and girls with anorexia even experience stops of their menstrual period due to small levels of estrogen. Amenorrhea often leads to weakness of the bones, corrosion of the teeth, and fragility of fingernails. Girls with anorexia have obsessive thoughts about food and being fat. They carefully count the calories they consume and often exhaust themselves by doing long, tiring physical exercises. Despite the efforts they sustain in order to keep fit and lose weight, girls with anorexia are never content with their body weight and physical appearance. They have a distorted perception of their body image and always consider themselves to be fat, even if their body weight is considerably lower than it should be. Young women and girls that have careers where a slim body is a necessity, gymnastics, modeling, ballet, are also susceptible to developing an eating disorder. It is very important to act quickly when dealing with eating disorders. Girls with anorexia are often unaware of the dangers they expose themselves to, and most of them deny having a problem. Some of them, however, are willing to sacrifice their health and jeopardize their lives only to be admired for their silhouette. Because girls with anorexia are usually unable to overcome their illness on their own, they should be provided with plenty of support and encouragement from their families and friends. Anorexics feel lonely and unhappy and have low self-esteem and self-respect. By proving to people who suffer from anorexia that low body weight isn't the most important thing in the world, and by showing them that they are unique and beautiful regardless of their physical appearance, you can help them make the first steps towards recovery. Supporting someone with anorexia. Anorexia is a very common illness to women. It is caused to eating disorder of a person. Sometimes people want to have a light weight because of their fear of being obese. We all know how girls of today want to have a slim and sexy body. They think that in order to do this, they would cut off any protein, calories, and carbohydrate intakes. But sometimes they do this method in an improper way, and they eventually lose a lot of their weight, leaving them really skinny and bony. In order for us to prevent people from suffering with anorexia, we need to support them in avoiding it. The following steps are ways on how we can support someone with anorexia. First of all, we need to learn about the early signs and symptoms of anorexia nervosa. We can research these from the internet about some anorexia issues. That way, we can find out if a person really is having eating disorders. We need to be careful not to overgeneralize on the behavior of a person. We need to actually see and witness the signs before we can conclude that it is eating disorder. Second thing is that we need to recognize anorexia to be life-threatening. It is not only a phase that a person goes through. 10% of every anorexia case are all fatal. They can even cause the death of the person we know if they aren't being aware. Believe it or not, the main reason for people engaging to eating disorders is because they want to have a perfect body. They feel unwanted because they have excess weight in their body. They have been influenced with the so-called ideal beauty of today. They need to have our support and attention for them to know that they are beautiful even though they are not slim or skinny. All they need to do is how to turn their fats into muscle mass and not actually shrug them off incorrectly. We need to be kind when trying to approach them. Anorexic people are actually very sensitive people. They just need to feel that they are accepted in our society even though they have too much weight. Tell them nicely in a proper way about what they really need. It is to have a healthy body and not just the plain skinny one. You also need to realize that what they have is an emotional and psychological problem. They need to be given help in that category. Anorexia only becomes a physical condition once the person lost too much amounts of weight, and it ruins her body system. Supporting someone with anorexia needs to be a constant and serious. People might come back again and again with their illness if they lost that support system again. The characteristics: anorexia nervosa. Anorexia nervosa is a life-threatening serious eating disorder in where an individual goes to extremes in order to lose weight, including self-starvation and excessive exercise. Eating disorders have no boundaries and affect people of all races, ages, economic status, and genders. It is estimated that 7 to 10 million women and 1 million men have an eating disorder. Anorexia is a very dangerous disorder which can be fatal when left untreated, as the lack of caloric intake affects all parts of the body, which include the major organs. The basic symptoms of anorexia nervosa. Typically, individuals are diagnosed with anorexia when their body weight falls below 15% of their normal weight due to their refusal to eat and maintain an above normal or normal body weight. These individuals typically have a history of self-starvation in which they will refuse to eat, and even when they do eat, they will self-induce vomiting. Many will also use laxatives in an excessive manner as well as diuretics. They perceive themselves to be overweight even when they are extremely underweight, and with their obsession to lose weight, many will often exercise to excess. Anorexia primarily affects women. It is estimated that 95% of individuals affected by anorexia nervosa are women. Typically, this disorder begins in early adolescence, and estimates are that 1 in every 100 young girls will experience this disorder. While the percentages are smaller, anorexia is also seen in men, young children, and adults. Anorexia is typically acquired by individuals who are high achievers and excel in work, school, sports, and other activities. Many people become anorexic to have the feeling of control over some part of their life, and in some cases, it is an act of rebellion towards their loved ones. Certain occupations also carry a higher risk for developing anorexia, which includes dancers, models, gymnasts, and runners. When caught in the early stages, anorexia nervosa is a very treatable disease. However, most individuals with this disorder refuse to admit that they have a problem and will not follow any form of treatment plan.